Good morning and welcome back to the third and final day of the New Cities Wellbeing Cities Forum. I'm your host, Greg Lindsay, Director of Research here, and it's now my pleasure to invite Mayor Jim Kenney of Philadelphia, a Wellbeing Cities finalist this year, to give his brief keynote on particularly how the city is dealing with housing residents with mental health issues. Mayor Kenney, the floor is yours.
Thanks, Greg, and thanks to all the members of New Cities. It's an honor for our city's work to be recognized by this important organization. I only wish we could be together in person to discuss this vital work. But even with this meeting being virtual, it is a real opportunity for all of us to learn about the efforts cities are pioneering across the globe to improve the quality of life for their residents. Our data supported connecting people with behavioral health challenges who experience chronic homelessness to scattered site housing was effective. So we're thrilled when New Cities informed us that Philadelphia is among the finalists in the Planning for a Better Urban Health category. Wellbeing Cities acknowledgement of Philadelphia's initiative addressing behavioral health and housing challenges is a much appreciated validation of our work. The program has a simple premise. Housing, first and foremost, should be considered a component of healthcare and effective treatment. Until we help people address the basic need for a place to live, we can't hope to achieve the most effective treatment outcomes. Because it is nearly impossible to focus on your behavioral health wellness when you do not have an adequate place to live. The concept seems simple enough. Of course, in a city the size of Philadelphia, it's anything but. Fortunately, back in 1992, the city's Department of Behavioral Health and Intellectual Disability Services, known as DBH-IDS, took the lead to make this work happen. For more than a quarter century, DBH-IDS has worked to develop public and private partnerships to make this initiative a success. What started as a general effort to address homelessness in the 1990s developed under DBH-IDS into a coordinated homeless outreach via certified peer specialists and mobile psychiatric rehabilitation services. The effort specifically focused on individuals with severe and persistent mental health and addiction issues in the 2000s. This evolved further with the creation of and piloting of the Housing First model, with hundreds of housing vouchers, rental subsidies dedicated to this purpose each year. During this time, DBH-IDS worked to provide linkages to tenant services coordination. And the department pivoted to transform their residential system to reduce numbers of congregate settings while creating individualized support for people in apartments. More recently, this program has been expanded to include spaces for those struggling with opioid use disorder, which is a problem of particular interest in our city. That expansion happened just last year, so we're still in the midst of analyzing the data. But we felt confident expanding because of how successful the initiative has been for the primary cohort. We measure outcomes based on the housing success rate, which includes the number of individuals who have maintained long-term stable housing. We're seeing that nearly 90% of individuals in the program remain housed, and 85% have remained housed for more than 5 years in the Housing First program. DBH-IDS also partners with the Philadelphia Consumer Satisfaction Team to conduct surveys with people who are part of the initiative as they prepare to move into independent living arrangements. These surveys show participants are taking part in community activities and looking forward to furthering education and gainful employment. Other measures being used to evaluate the success of the programs, such as reduction of hospitalizations and incarcerations, increase in employment, and continued participation in appropriate services to maintain wellness. With the security of a roof over their heads, these individuals are improving their own health and the health of the entire population of our city. Well-being has to begin somewhere. In Philadelphia, it begins with a home. Our city prioritizes housing vulnerable citizens as a first step, a physical foundation for a diverse array of well-being services. This is never more true now that in 2020, in the midst of a global pandemic. Only with this most fundamental need met can we hope to truly improve the quality of life for all. So again, on behalf of DBH-IDS and all city departments that have been part of this effort, and on behalf of all Philadelphians, we thank you again for this recognition. And more importantly, we thank you for your work to improve the lives of millions who are struggling at this difficult moment in our history. God bless you all, and let's keep up the good work. Thanks.
Thank you so much, Mayor Kenney, for your remarks. It's a pleasure having you.
Thank you.
For those of you who are attending, we're now going to switch over momentarily to our workshop sessions of the morning. Our first workshop, brought to you by Secure Access, is Do You Listen to Your City? Turn urban sounds into information and actionable insights. So thinking about the audio and oral dimension of our cities. And the second workshop is going to focus on new social environments for prevention and health. And that's brought to you by our partners for the Wellbeing Cities Forum at Novo Nordisk. So thank you again, Mayor Kenney. It was great to have you, and congratulations again to Philadelphia for being a finalist this year. And we'll see you all shortly in our workshops.
Cheers. Be safe. Thank you.
Thank you, Mr. Mayor.